So this patient's just coming in for removal of these scaling exophytic lesions. I'm working with Dr. Laser again today.
Yeah.
What are these specifically?
That is seborrheic keratosis.
Yeah, seborrheic keratosis. Do these have any malignant potential whatsoever?
No.
No, none whatsoever. And why do they form in the first place?
That's a good question.
It is a good question, and I don't fault you for not having an immediate answer, because there's not a specific reason that they know specifically. They do talk about sun exposure over your lifetime contributing somewhat to it, but it's not consistent. And for reasons we're not clear, some people get tons of them and some people get none. So this is where we're getting at with this. So there's various ways you can take these off. If people are getting really big, thick ones, and there's a time frame that's involved, like whether you're talking about having a wedding or something coming up, we can do it this fashion, which is we're going to freeze underneath it, we're going to bifurcate it, we're going to cauterize it, and then just scrape it off. So this is a poke here. I apologize. You're going to feel a poke. And you feel burning. So this is the part that always stings. Topical anesthetic and injectable anesthetic is not comfortable. So we just want to make sure that it blebs all the way around. And Dr. Laser, sorry, I misnamed you.
Thank you.
What's the toxic dose of what I'm injecting? What am I injecting?
This is lidocaine.
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 Yeah.
This is 1%, right?
Yes, it is. And
With
what
epi, so
class medication is this?
It's I guess I would say like a local anesthetic.
It's a local anesthetic, and what's its secondary? It has a secondary.
Conduction blocker.
It's an antiarrhythmic, so it's a class 1B, and so that's where we get into issues with respect to toxic doses.
With epi is 7 mils per kilogram.
Yep, 7 milligrams per kilogram. Yeah, and without
5.
Yeah. And why is it more with epi?
Vasoconstrictive effect.
Yeah, vasoconstrictive effect, and this is why I asked about the function. The toxic effect is cardiac, which epinephrine offsets.
Right.
Do you want to grab the hypercator for me?
Yeah, that does make a lot of sense.
Grab that there for me. So this is just to cauterize the spots to re-injected. Just like that. And I just want to check this. Does that hurt at all when I do that? Any pain?
No.
So generally, how quickly does lidocaine work? Like, what's the?
I would say within 30 seconds.
That's the
3
general.
months.
Yeah, the studies will show up to 4 months. Most people will be almost immediate. So we'll just use the bifurcator. We're going to bifurcate this. So see how friable it is?
Right.
That's not hurting at all?
No.
So all of this will just slough off.
Is an alternative method to this just to use like scissors or a scalpel and cut?
Well, this is what we end up doing. But doing it this way just makes this easier. So once you'll take your number 15 blade, when you irritate it, it just flakes off easier.
Oh, okay.
So you just take this like this. So as opposed to having to really cut into the skin, you can just do that. And then see, once I get to this level, I'll just take the bifurcator back out, and then we'll cauterize these areas. You're comfortable?
Yes.
So, and this is something we'll certainly do if it's, just a large one that just would take forever to use liquid nitrogen for, which you can use as well. And there's other topical treatments that sometimes work well. There's a product here in Canada called Actikerol that can work okay for this. It's a little bit caustic. Very similar to, what they use with molluscum with cantharin.
Oh, Beetlejuice.
Yeah.
I heard a pediatric dermatologist talking about the cantharin, but I don't know if I would ever prescribe that over just using like liquid nitrogen.
You can. It's not as irritating, as long as you know. If you put like just Vaseline around the base of the lesion, it'll actually work pretty well. So it's not as a lot of the a couple of the dermatologists, I shouldn't say a lot. There's one in our area who actually likes to use it, and I've actually used it a couple of times too. It actually works well. So all I want to do here is just form like a mild scab on the surface. These irregularities that are through here, this will heal in, this will scale in nicely, and then she'll have skin that replaces this.
Will there be a scar at all?
You'll still be able to see it, usually from a pigment perspective. But this is the nice thing with these the more you can do these type of treatments as opposed to, actually cutting it out. It's when we cut out tissue and put in stitches that you'll have typically more of a scar potential. So this area is going to heal and nice. This is what I wanted to look at. This is where the ridge is here. We'll have to sort of see whether we have to touch that up after. I don't think we'll have to, because that'll likely fill in. So once I get it to this point, I just want to decrease the gain. And I'll just do a gentle cautery through this area. And what looks like a big, sort of area we've scarred down, this will flake off and fall off over the course of the next few days. And that's it.
You know the drill. Over on Patreon today, Dr. Butler and Dr. Laser are going to remove this basal cell cancer. If you want to see it, click the link in the caption. Have a great day. Bye.